it's Dr. Rick back again with another update regarding the COVID-19 vaccination programme in our local area. Yesterday, I explained how the COVID vaccination call-up lists are now starting to get a little bit complicated. Initially, we called up people aged over 80, and it's rather easy to find people aged over 80 and identify them simply because of their date of birth. And then we moved on to people aged 75, and then down to people aged 70, but also those with extreme clinical vulnerability. Now, there's a very clear list about which people should be classified as having extreme clinical vulnerability, and this is published on the government websites. But at the end of that list, it does say if the doctor who knows you best thinks you have a mixture of conditions which places you at extreme clinical vulnerability, you should be in the current call-up list for a COVID vaccination. In addition, the current cohort of people being called up also includes people with learning disabilities. And it's not clear exactly how much learning disability you need in order to be called up. So you can see how things are starting to get a little bit more complicated. Now, there's also a group of people who really need to be vaccinated because they are placing themselves at risk of picking the infection up, and that's health and care workers. So far, the vast majority of people working in the NHS or for local authorities have been vaccinated, especially if they're working face-to-face with groups of people in society. But in addition to this, our care services are supported by a vast array of private workers, so private physiotherapists, podiatrists, dentists and opticians. And of course, they all come into very close contact with other people. You can't possibly be a dentist without coming into close contact with other people. Across Manchester, letters and other communications have gone out to as many of the private frontline workers as we know about in order to make them aware that they are now currently eligible to have a COVID-19 vaccination. I certainly know that opticians in my local area have taken full advantage of this. So if you're one of these workers and you haven't seen this communication yet, please get in touch with your registered professional body and make some inquiries about how you go about booking you and your staff in for a COVID-19 vaccination. It's really important because private physiotherapists, podiatrists, dentists, opticians and also private care staff have been offering an amazing and an essential service to many vulnerable people in society. And it's very important these people don't catch the coronavirus and don't pass it on to their clients. The vaccination programme in Tameside and Glossop is going really well, and new supplies of the vaccine are arriving all the time. And everybody can feel confident that as soon as these vaccines arrive, they are used within days.